The White House is facing increasing scrutiny after significant citation errors were uncovered in a high-profile report released last week by the Make America Healthy Again (MAHA) Commission. The report, championed by Health and Human Services Secretary Robert F. Kennedy Jr., claimed to expose the root causes of rising chronic illness in children across the United States. Touted as a revolutionary piece of public health research, the report cited hundreds of studies to support sweeping conclusions about the impact of ultraprocessed foods, pesticides, prescription drugs, and childhood vaccinations. But growing evidence suggests the report's scientific foundation may be riddled with fabrication, misrepresentation, and sloppy scholarship. Nonprofit news outlet NOTUS broke the story, revealing that many of the report's citations were either inaccurate, misattributed, or outright non-existent. Among the most concerning discoveries was the inclusion of studies that cannot be found in any medical or academic database. Epidemiologist Katherine Keyes, for example, was listed as the lead author on a study about adolescent anxiety, but when contacted by NOTUS, she confirmed the paper cited does not exist. While Keyes has conducted similar research in the past, she said unequivocally, "The paper cited is not a real paper that I or my colleagues were involved with." This revelation has cast a shadow over the credibility of the entire MAHA report. In multiple cases, real studies were cited but their findings were blatantly mischaracterized. Mariana Figueiro, a respected researcher at the Icahn School of Medicine at Mount Sinai, was cited in the report as having proven that screen time disrupts sleep in children. But the study she co-authored actually focused on light exposure in college students and didn't directly measure sleep patterns. "The study is ours," Figueiro told USA Today, but unfortunately, the conclusions in the report are not accurate and the journal reference is incorrect. The White House has attempted to minimize the growing controversy. When asked by NOTUS during a Thursday press briefing about the errors, Press Secretary Karoline Leavitt described them as mere, formatting issues. She went on to praise the report, calling it one of the most transformative health reports that has ever been released by the federal government. Critics say this dismissal raises troubling questions about transparency, accountability, and scientific integrity in government-sponsored health policy. Later that day, the White House quietly replaced the original version of the MAHA report with a revised edition. The updated version swapped out many of the fictitious or incorrect citations with new ones that appear to be legitimate sources. According to an emailed statement from HHS spokesperson Andrew Nixon, minor citation and formatting errors have been corrected, but the substance of the MAHA report remains the same. However, this assertion has done little to quell criticism. Researchers and journalists continue to raise alarms about the underlying methodology and intent behind the report. Separate investigations by the New York Times and the Washington Post suggest the errors may not be accidental. Citing unnamed sources and internal document reviews, both publications have indicated that generative artificial intelligence (AI) tools may have played a significant role in compiling the report. These tools, including language models trained to produce text, are known to hallucinate, generating plausible-sounding but false information, including fabricated references. Ivan Oransky, a professor at New York University and co-founder of Retraction Watch, emphasized that this risk is well known in scientific and journalistic circles. This is a textbook example of what happens when AI is used without verification. You get fake citations, misleading interpretations, and ultimately a misinformed public. The authors of the MAHA report have not been publicly named, and Kennedy has refused to reveal who contributed to the document. This secrecy, combined with the growing evidence of misinformation, has only fueled speculation that the report may have been constructed hastily or even deceptively, under the guise of scientific legitimacy. Critics argue that invoking AI tools without proper oversight may represent a dereliction of duty at best, and a deliberate effort to mislead the public at worst. Meanwhile, health professionals and researchers are urging the government to conduct a formal review of the MAHA report's claims and sources. Many worry that its findings, now widely circulated, could influence public perceptions about childhood health and vaccine safety, even if those findings are flawed. "There's a real danger here," said Dr. Alicia Grant, a pediatrician and public health advocate. "When government reports misstate the science, it doesn't just undermine trust in the system, it puts kids at risk by spreading bad information." Some lawmakers have begun to weigh in, calling for greater transparency and accountability. Senator Maggie Harcourt of Vermont issued a statement on Friday calling for a congressional inquiry into the report's development and publication process. The American people deserve to know who wrote this report, what sources they used, and whether any of it can be trusted, she said. Public health policy should be based on sound science, not computer-generated fiction. Advocacy groups, including the National Academies of Sciences and the American Public Health Association, have also expressed concern. Several organizations are now pushing for stricter federal guidelines on the use of AI in scientific research and government publications. Artificial intelligence can be a powerful tool, said APHA President Dr. Ramon Vega, but only when used responsibly. This situation shows what happens when that responsibility is ignored. Despite the backlash, Kennedy has stood by the report's central claims. In a public statement issued through HHS, he insisted that the MAHA report represents an honest and necessary reckoning with what he calls a childhood health crisis of unprecedented scale. He acknowledged minor mistakes in citations but dismissed the criticism as politically motivated. Our children are sicker than ever, he wrote, and the forces profiting from their illness are trying to silence us. Yet experts warn that disinformation, whether deliberate or accidental, can be just as dangerous as the threats the MAHA report claims to expose. With trust in institutions already fraying, the misuse of AI in scientific citations could further erode public confidence in health authorities. The situation has become a case study in the double-edged nature of emerging technology. While tools like AI can accelerate research and communication, they also magnify the risks of error and deception when not properly managed. Public reaction to the controversy has been mixed. Some see the MAHA report as a bold challenge to the status quo and are willing to overlook what they view as minor citation issues. Others are deeply disturbed by the possibility that fabricated sources made their way into a federally endorsed document. On social media, the hashtag MAHA report has begun trending, with users debating the line between advocacy and misinformation. Academic institutions are now considering internal policy changes. At Columbia University, where Katherine Keyes teaches, a faculty committee has been convened to examine how AI-generated content is used and cited in public-facing research. This episode is a wake-up call, said Dr. Renee Morton, chair of the committee. We need clear standards not just for accuracy but for ethical responsibility in the use of AI. In the days since the story broke, NOTUS has continued to investigate the origins and claims of the MAHA report. Their reporting has unearthed additional discrepancies in the updated version. Some citations, while now technically real, do not support the points being made in the report. This calls into question whether the revisions were aimed at improving accuracy or simply at avoiding embarrassment. Calls for accountability continue to mount, with watchdog organizations filing Freedom of Information Act (FOIA) requests to uncover more about the report's drafting process. Transparency advocates argue that public trust hinges on the government's willingness to own its mistakes and correct them thoroughly. We can't move forward if we don't know how this happened, said Tanya Reynolds, director of the Center for Scientific Integrity. Who approved this report? Who reviewed the sources? Was any of it peer-reviewed? Amid all this, the credibility of the MAHA Commission, and of Kennedy himself, has taken a hit. While some of his supporters argue that the substance of the report is still valuable, others are calling for his resignation from the HHS role, citing a failure of leadership. The broader implications are still unfolding, but one thing is clear: in an era where truth is under constant assault, the integrity of science must remain non-negotiable.